New Mexico Cancer Center and Health Specialist of New Mexico are the proud sponsor of health and wellness on New Mexico Living.
My name is Gil Heredia. I'm a family physician. I work with New Mexico Cancer Center. I work in primary care, but also cancer survivorship program there. Cancer survivorship program is a program that is the treatment after the treatment. The treatment for cancer is followed by treatment for monitoring for cancer, monitoring for any symptoms of any of the medications that are used to treat the cancer, but also taking care of the whole patient, meaning those patients that have cancer and were treated for cancer also have things like diabetes and high blood pressure and high cholesterol and heart disease and things like that. And those things still also need to be treated. Also, in cancer survivorship, some of the medications that we use to treat cancer can cause long-term side effects, such as, for example, neuropathy or nerve pain. And so we help manage those kind of symptoms, but also some of the other medications cause osteoporosis. And so we want to monitor for osteoporosis. So we're not only managing the patient from the point of view of surveillance for their cancers, but also for managing their everyday diseases, but also monitoring for any of the side effects of the medications that are used to treat cancer. Because after all, this is care of the whole patient. The patient is not just defined by their cancer. They're a human being, just like all of us here, and they deserve to be cared for in the best way possible. So that encompasses not only their medical health in terms of their cancers and their diabetes and their blood pressures and things like that, but also their mental health. You know, sometimes it's very anxiety provoking to have cancer, to get that diagnosis of cancer, but also anxiety provoking to go through the treatment for cancer. And then it can be very anxiety provoking once you've overcome the treatment and defeated the cancer to worry about getting it again. So we're there with you. We're there for you. You're not alone. We're there for you, and we can form a very together type of team. Right now, there's probably something on the order of 11 million cancer survivors in the United States right now. By 2030, just 5 years from now, it may be 30 million. So there's going to be a lot of cancer survivors, and they all need their own special type of care. So recognizing that we need a survivorship program is very important. Through the leadership of Dr. McEnany and Dr. Fontaine, they recognize that cancer survivorship is very important for care of the whole patient. We also have a New Mexico Cancer Center Foundation, which helps with the monetary cost, the financial burden of cancer care itself. Sometimes when you have cancer and you're getting treated, it's hard to work. It's hard to make ends meet, pay the rent, pay bills, etc. And we can help out with that through the New Mexico Cancer Center Foundation. Yeah, it's essential to continue taking care of the patient because once again, they are actual human beings, not just a diagnosis. So it's important to recognize that. Some of the side effects from the cancer itself may not present themselves for many years. We have to continue monitoring the patient for many years sometimes, but also some of the side effects from the medications may not manifest for many years. So it's important to have a long-term relationship with the patient, not to mention, of course, the fact that they have diabetes, hypertension, which are lifelong diseases oftentimes. Dr. McEnany and Dr. Fontaine are two amazing leaders at the New Mexico Cancer Center, and they have a great vision of taking care of the patient. And they've shared that vision with the rest of the staff, everyone from the medical oncologist, radiation oncologist, primary care, all the specialists, but also all the support staff. The medical assistants are amazing, the patient care coordinators are amazing, and the New Mexico Cancer Center Foundation personnel are amazing. So we are really centered on patient care, and that's our primary purpose. We're not going to be swayed from that.